We want to talk some now about this crisis over Ebola. And joining us from Nashville, the head of the Vanderbilt University Department of Preventive Medicine, Dr. William Schaffner, and our own CBS News chief medical correspondent, Dr. Jon LaPook. He is in New York, of course. Dr. LaPook, let me start with you. We got reports this week that the CDC is estimating the number of cases of Ebola by the end of January as possibly affecting as many as 500,000 people. Now, this research has not been made public yet, but can you tell us, do you know anything about this? Does this sound right to you?
Well, I did reach out to the CDC this morning, and they're backing away from that exact number, but they are going to come out in the future with some estimates. But I think there's no doubt this is a huge problem. It's daunting, but there are some encouraging signs because obviously this is the biggest international effort that we've ever seen for an outbreak. And in addition to understanding that you have to supply people with hospitals, with training, with personnel, there's also the realization that you need to build trust. And that's been one of the big problems here because people have been running away from healthcare. So, for example, I spoke last night to Dr. Paul Farmer, who's the head of Partners in Health, and to Raj Panjabi with Last Mile Health. They met with President Sirleaf of Liberia last week, and with the idea of, for the very first time in Liberia and in Western Africa, making modern medicine available so that people actually run towards healthcare rather than running away from it. And Paul said to me, when in history has Ebola ever collided with modern medicine? Never.
Dr. Schaffner, the president, as we all know, assigned 3,000 U.S. military personnel to deploy to Africa in this fight. How much impact do you think this is going to have? Obviously, it's going to help some, but how far do you think this will go? Will we need to do more?
Well, this is a big problem, and perhaps we'll need to do more, but this is an important beginning. The military is going to go in there and put in field hospitals, MASH units, if you will, and do an awful lot of training of locals. Don't give a man a fish, teach them to fish. And we have to leave that infrastructure in place. We're going to have to organize medical care, just as Jon has said. It's very important for two reasons, not just the humanitarian reason. We want to take care of these very sick people, but also we need to get those sick people out of homes. That's the public health reason, because when they're cared for by people at home, their family members, that's where transmission occurs and the next cases occur.
What do you think, Dr. LaPook? I mean, obviously, this would not be the assignment that I think most people in our military have been hoping to get. This is a very dangerous assignment. What do you see as the challenges for these people that are going to be going there?
Well, I think it must be daunting to think about going over there. They're not going to be having direct contact with patients, and I think that's very important because there's been a lot of misinformation around here. It's not airborne. You don't get it like you get the flu. You have to have direct contact with fluids. But I think it's such an important thing because it's not only affecting the people directly who have Ebola, but as Dan Kelly, who's a doctor who I spoke to who was in Sierra Leone, said to me, Ebola kills healthcare systems. So think about it, all the people who are staying at home with things, with fever, with gastroenteritis, who end up having malaria, they're afraid to go to the hospital, so they end up dying at home. So this is such a huge problem, and I think the world is understandably and correctly reacting to it in a massive way.
Dr. Schaffner, we've been talking about how trust is such an important part of this. I noted that yesterday some health workers were attacked while trying to bury Ebola victims. We're starting from ground zero on this. How do we do that to convince people that our people are going to be there to help?
We're going to have to just keep on doing the right things, and we need to communicate more effectively with the public. Without the public's trust and cooperation, the epidemic will continue no matter how much medical care we provide. So we need to communicate clearly and compassionately with folks in ways that they understand.
I notice,
Bob, I saw a remarkable video that Dan Kelly showed me from Sierra Leone, and in it there was a woman carrying a baby, and he asked her, are you afraid that if you go to the hospital, they will inject you with Ebola to give it to you? And she said, well, we hear a lot of things, I don't know what to think. Imagine there actually was a possibility in her mind that doctors were giving the people Ebola. So that's what we're up against.
Dr. Schaffner, any final word?
This is a big start. It's an international effort. It's terribly important. It's impacting the economies of these countries. This is something we need to do, and I think we ought to be proud that we're sending a group of military experts there to help out.